Did they have a lot of this gear, or what was there any follow-up when you raised objections to, I mean, what is clearly a ridiculous situation, a dangerous situation?
I immediately felt like it was ridiculous. And I immediately posed the same question that you're posing to me, asking me right now. I said, why? What explanation can you give me or anyone about why we would be in the second week of an Ebola crisis in our hospital and we don't even have the same equipment or protection that's given to sanitation workers that have no contact with patients at all? And they said, we know, we've ordered it. And the most outrageous part about it is that every time I think about the facts that I'm saying right now, I just know that the nurses that have been infected, they were dealing with the same equipment while they were dealing with so much more than I dealt with personally. They were dealing with an Ebola positive patient with copious secretions of diarrhea, vomiting, continuous dialysis, mechanical ventilation, all these dangerous medical procedures. And they put their lives on the line and without the proper equipment. And there's nothing.
You believe Nurse Pham was wearing that kind of equipment when she was exposed?
I know she was, because the equipment we needed was still on order.
Well, the hospital has not responded specifically to Brianna's accusations, but earlier today, they did respond to the broader allegations from that union, National Nurses United. Now, the hospital says when Mr. Duncan returned to hospital the second time, he was moved directly to a private room and placed in isolation. They also say nurses who interact with Mr. Duncan wore protective equipment consistent with the CDC guidelines at that time.